Good afternoon. Pnawn da a croeso cynnes I chi gyd. Good afternoon and a warm welcome to you all. Welcome to the All Wales Cancer Care Review online training. I'm Sue Llewellyn. I'm the Macmillan Lead Nurse for the Macmillan Primary Care Cancer Framework Programme. And welcome to our first Module 1. Housekeeping. I won't go through these as it is a recording, so I'll move on to the next slide. Thank you. Before we start, if you can complete a pre-training questionnaire, this Mentimeter will be live for 2 weeks after we've recorded it. So on your mobile, tablet or laptop, enter www.menti.com and then enter the following code of 17931440, and I think there's about 6 questions for you to complete. These questions will help us to measure the impact of this training, so it is important to be open and honest with your responses. And your responses are anonymous. Thank you very much for completing the questions. So, this is our nursing team. Normally, we would be doing a face-to-face educational event, but due to COVID-19 restrictions, we are adapting with the online training and learning with Microsoft Teams. So the module today is will take 30 minutes long. And as you can see, these are pictures of myself in the middle and Hayley Phillips in the yellow, who is the regional nurse South West Wales, and Juliet Norwood, who's on the left-hand side, who is the regional nurse for South East Wales. And Juliet and Hayley are with me today on this recording. So who are we? So let me give you some background to the Macmillan Primary Care Cancer Framework Programme. We are a 5-year programme of multi-professionals, nurses working across regions and GP leads and GP facilitators in each 7 health boards. We also have a central team to support and complement our programme. The programme was funded by Macmillan Cancer Support. The work of the programme and the primary care team are now being embedded into the Wales Cancer Network. And the aim of the programme was to develop and support primary care professionals, improve communication and integration between healthcare sectors. 3, develop and grow a community of practice of experts and leaders to support cancer services improvement in primary care. Our work is around education, providing resources and tools and service improvement work around cancer in primary care. So let me share with you now some of the work that we have done, are in the process of completing. And as you can see, we've done a huge amount of work on patient surveys, cancer care reviews, what we're doing today, rapid diagnosis centres that are across Wales at the moment, and cancer buddy training. So we'll be touching on that later on in our modules. Some of you may be familiar with the toolkit and have signed up to complete the toolkit a couple of years ago. And the Macmillan Cancer Quality Toolkit for Primary Care was launched in May 2019. And this toolkit has been designed by the framework with GPs and nurses. And the toolkit has a multidisciplinary approach throughout, from receptionists to practice nurses and GPs working together to improve cancer experience for patients. There are 5 modules, as you can see. The nursing team is particularly produced the module 4, which is the mandatory module looking at cancer care reviews and long-term consequences. So the cancer care review online modules supports module 4, the toolkit. To date, over 52 GP practices across Wales are signed up to the toolkit, and the toolkit is currently being evaluated, and the results will be available later next year. So coming back to today's module, the programme is to cover for the next 5 weeks. And module 1 today is a brief taster to better understand the purpose of a holistic cancer care review in primary care. And the module 2 next week is delivered by Dr. Gemma Eccles, who's the GP lead in Swansea Bay. And she will be taking us through the biology and the consequences of cancer. Module 3 will be delivered by Juliet Norwood, who's the regional nurse for South East Wales, and who is also a practice nurse in a Cardiff surgery. And she'll be taking us through how to guide with the cancer care reviews. Module 4 will be delivered by Hayley Phillips, a regional nurse for South West Wales, and she'll take us through the cancer signposting and cancer information and support services. Module 5 will be an interactive module to bring the learning together and understand how we can support you with what next. So this is our 3rd cohort of Holistic Cancer Care Review training. And we completed one again last year. We've had very positive feedback regarding the training. And as you can see on the screen, this is some of the feedback that we've had in our last cohort. If you take anything away from this introductory module today, please remember that it's not much different to a lot of chronic disease management that the nurses are good at doing. You do asthma reviews, COPD reviews, and cancer care reviews are no different. And the course is all about giving you the tools just to do this. So module 1, the aim of this module is to understand the purpose of a holistic cancer care review in primary care. So let's look at the picture in Wales. Consequent national cancer plans, including the Welsh Government's Cancer Delivery Plan for Wales, which was 2016 to 2020, have highlighted the importance of person-centred care and meeting the needs of people living with cancer. The Wales Cancer Patient Experience Survey of 2017 highlighted that of patients who require help or care from their GP practice after leaving hospital, only 56% stated that they definitely received the help they needed. A holistic cancer care review is carried out and documented effectively, offers an opportunity to plan care holistically and meet the needs of people living with cancer. Just under half, 48%, of the Wales Cancer Patient Experience Survey respondents reported that they had an opportunity to discuss their needs and developed a care plan. This presents a key area for improvement, as those who have had the opportunity to discuss their needs reported more positive experiences across all phases of the patient journey. The rise in number of cancer survivors and demands on secondary care has led to an increase in patients that require assessment and management in primary care. Cancer treatment is often invasive and can have both short and long-term consequences. These can be physical, social, or psychological in nature and can arise days, months, and even years after treatment. Failure to identify and effectively manage these distressing problems can compromise survival, recovery, and quality of life for patients and their carers. On average, NHS Wales receive over nearly 2,500 urgent suspected cancer referrals every week. We now refer to them in Wales as suspected cancer pathway, SCPs, are being reported from a new system which collects patient level data. As the single cancer pathway provides more accurate patient weights, the old measure of urgent suspected cancer and non-urgent suspected cancer are being retired. Wales is the first UK nation to to report on cancer waiting times in this way. The pathway has been designed to cut waiting times for cancer diagnosis and treatment, with the aim that all patients begin their treatment no later than 62 days from the first time cancer is suspected. So this is a current snapshot from the Wales Cancer Network data. We know that the curve really dropped at the beginning of COVID-19 in March last year, and slowly we are seeing the curve increase in most cancer specifics. We know that early diagnosis and treatment can have better outcomes and potentially save lives. The pandemic of the coronavirus will lead to 1,000 more cancer deaths, as the virus has disrupted service and some patients have avoided healthcare. Since the national lockdown, cancer screening was initially suspended and routine diagnostics were deferred to a period of time. But patients' numbers are increasing for diagnosis and treatment. And you can see on the blue line on the chart that this has now really gone above previous readings. Sadly, we have a backlog of patients who will have late diagnosis and poor outcomes. This will, without a doubt, have the impact on primary care. Therefore, there is no better time to support cancer patients in primary care. I would now like you to listen to Eleri's story. This will take about 6 minutes long. Eleri is a dear colleague of ours who has recorded her cancer story at home during COVID-19 on her mobile phone, and I'm glad to say she's happy to share her experience with us. You may need to adjust your sound in view of the sound quality of this recording.
My name's Eleri, and last year on April 30th, 2019, I was diagnosed with breast cancer. I'm married to Steve and I have 2 grown-up children, Katie and Jonathan, and 2 gorgeous grandsons who are 7 and 3. My breast cancer was diagnosed through Breast Test Wales, and it was only the 2nd mammogram that I'd ever had. My diagnosis was a bit of a shock. We've got no history of breast cancer in the family, so it was a bolt from the blue. Didn't tell anybody apart from my husband. Went and had biopsies, etc., and went back the following week for the results, which was really quick and really all well done. My recovery from my surgery was fine. I met my practice nurse post-surgery just to have my wound and my dressing checked, and then the dressing removed. It had been a little bit difficult to get an appointment to see her, but I did manage. I hadn't had anything more to do with the practice nurses at all. My GP was aware of my diagnosis, and I saw her back beginning of May before I had my surgery. She was very, very, very supportive and suggested that I actually took some time off work before I had my surgery to get my head straight and get myself prepared for my surgery. One of the things which I did find very hard was I kept my professional hat on the whole time I was having my treatment. I'm very organised, I'm very practical, and that was my way of coping. So I never allowed myself to be a patient. I just kept plowing through, and I just wanted to get back to work and just go back to being me. And I think that was the wrong thing to do in hindsight. I didn't want cancer to define me. I didn't want it to be a big part of me. But I also was worried that if I showed any weakness, that it would reflect in my ability to do my job. A job that I absolutely love, and I didn't want anybody to think that I wasn't up to it anymore. So I went back to work in December on a phased return to work. I have to say my line manager was amazing. She was so supportive throughout the whole thing. it was difficult going back to work. I thought I was doing okay, but had begun to notice that I wasn't sleeping, I wasn't eating, but also the fatigue that I'd had after the radiotherapy had started to get worse, and in the end was much, much worse than actually the post-radiotherapy fatigue that I'd had in September. So I made an appointment to go to see my GP, and she was absolutely incredible. And she said, well, you've got depression, it's sort of a form of PTSD, it's a reaction to, you know, having come through what you've come through. I took a little bit more time off work. She started me on antidepressants because she felt that although physically I'd healed, I needed to mentally heal as well, and suggested counselling. She offered me access to the counsellor at the surgery, but I've already made contact with Maggie Centre in Cardiff, and actually that's where I went to for help and support and eventually one-to-one counselling, and that was incredible. Certainly helped me to see where I needed to be, what I needed to do to help myself, and helped me to go back to work. I've now been back in work since the middle of March, but work is so much better this time round. I've got my head straight. I have two hats. I have a Larry the patient hat and a Larry the professional hat, and I take them off and put them on as and when I need them. One thing I think which does stand out is that during my treatment I was given a HMA form to fill in, which I did, and I did voice the fact that I was struggling between that, not being able to differentiate between being a professional and being a patient. My HMA was never followed up. I never had, nobody contacted me, nobody offered me any support during that time, and I also didn't have the cancer care review done at the surgery, and I do think that had either one of those been done, that possibility that flags possibly would have been raised a little bit earlier, and I may not have got as bad or as low as I did get in February, and I could have looked for support, counselling a little bit earlier. It's just, you know, that's just the advantage of hindsight, and you know, a little bit of space to look back and reflect on how things have been. But doing really well, feeling really well, enjoying work. I have my first 12-month follow-up appointment next week, so fingers crossed for that. And looking forward to the future.
Thank you, Larry, for sharing her story, and a big thank you to Michelle, who put the podcast together. Larry was diagnosed, as she said, with breast cancer while having her second mammogram. And to summarise the learning, Larry said in her reflection, if she had received a HNA, Holistic Needs Assessment, or a Holistic Cancer Care Review during her journey through secondary and primary care, she may not have become too low in her mood, and her PDSA and depression issue may have been addressed sooner. You can see the definition of what a HNA and a cancer care review is on screen. A HNA is usually done in secondary care, and a holistic cancer care review done in primary care. There is mounting evidence that shows the more concerns people with cancer have, the more distress they feel. But it can be difficult for people to discuss what's worrying them, or for healthcare professionals to pick these concerns up. Hence, using a template for holistic cancer care review really focuses the conversation on what really is important to the patient. A holistic needs assessment, or a HNA, is a simple questionnaire that is completed by a person living with cancer. It allows them to highlight the most important issue to them at that time to inform the development of a care and support plan with their nurse or key worker. The questionnaire can be completed on paper or electronically, eHNA. Evidence also suggests that a person's holistic needs are likely to change at transitional points in their cancer journey, such as after diagnosis, at the end of treatment, or if something else affects their health or social needs. We advocate a holistic cancer care review is offered to cancer patients approximately 4 to 6 months after cancer diagnosis in primary care. Both HNA and a cancer care review would then be followed up with a care plan. And Juliet, in Module 3, How to Guide, will be sharing a selection of templates in how to do a complete holistic cancer care review. So let's look at the benefits of a holistic cancer care review from a professional and a patient perspective. So from a professional, a cancer care reviews are particularly relevant during these times of COVID-19. People with cancer can be living with fear, isolation, uncertainty, and loneliness. And it is especially important during this time for the primary care team to offer this support to people living with cancer. The Macmillan National Helpline reported that 1 in 3 calls they receive is around COVID issues. A holistic cancer care review will help to focus the conversation on the things that are most important to the patients, and this needs to be patient-led. Encourage patient to self-management. During Module 4, we will provide you information about what services are available to support self-management. And research shows that a holistic cancer care review focuses discussion, managed discussion times, and overall a better job satisfaction. Following a cancer diagnosis, many patients increasingly contact their GP practice for medical advice. To better support these patients, it's important that key information about their cancer diagnosis, key worker, and treatment are documented on their patient record, and this will then inform the wider primary care team. This information also needs to be clearly highlighted to practice staff so they can effectively identify, assess, and manage any concerns or risks. And from a patient perspective, reassurance and support during COVID-19. As previously said, it needs to be patient-driven, patient-led. It improves experience and care for the patient and their families, opens the door for discussion and informs people about further support. And more importantly, and thinking back on Larry's story, encourage people to seek help straight away, preventing a concern becoming more acute. And it provides a quick and easy way for the person affected by cancer to highlight their concerns. Let me now introduce you to Juliet Norwood, who's the South East Regional Nurse on the programme. She won the Wales RCN Primary Care Award in 2018 for her work with practice nurses around her work in holistic cancer care reviews. Juliet is now going to share with us how she managed to set up a cancer care review in her daily work as a practice nurse in Cardiff. Over to you, Juliet. Thank you.
Thank you very much, Sue. As well as my role with the Macmillan Primary Care Cancer Framework, I'm also a practice nurse, and I still work as a practice nurse now. So my interest in cancer started in 2013 when I attended a Macmillan Practice Nurse course. And prior to this time, I did feel that I was good at talking to people about their diabetes, their asthma, COPD, hypertension, etc. But I avoided talking to people about their cancer. And why was this? It's because I felt I knew very little about cancer, and I was afraid that I wouldn't be able to answer any questions that people had. And prior to the Macmillan course, I had never attended a course about cancer, and I was also afraid of the emotional side of talking to people about cancer, and also felt I didn't have time in my busy day. So after completing the course, I went back to the surgery I was working in, and I was very fortunate in that the GPs I worked with were very keen for me to start carrying out cancer care reviews. So I worked alongside one of the admin staff. She gave me a list every month of all newly diagnosed cancer patients, and it wasn't a long list. We had 18,000 patients, and I'd receive a list of maybe 5 to 10 patients each month. So as there weren't many patients, I was able to look through the list and find out if it was appropriate for me to contact them. I found that between 4 and 6 months was an appropriate time to contact them, and generally they'd finished their active treatment and were out in their homes in their so-called new normal lives. And this was often a very lonely and anxious time for them after the acute treatment had finished. So I contacted them to invite them for a cancer care review, either face-to-face or over the phone, whichever they preferred, and I allowed 20 minutes for each appointment. So it was nerve-wracking initially, talking to people about their cancer, but as with all other reviews, I soon developed a way of talking to people. I invited them to talk about what actually mattered to them, whether it was financial, social, emotional, and so forth. And I soon realised that I didn't need to know a lot about cancer to talk to them about what mattered to them. I needed to know a little bit about cancer, be able to listen, and also to know where to signpost people to. And this was so rewarding to me. It opened up a whole new area of my work. And I soon found out that other patients heard about my role in the surgery and would book appointments with me to talk about cancer. So other relatives, friends, etc. And I became a go-to person within the surgery for people with cancer. So with so many people being diagnosed with cancer, so many people living longer with cancer, as clinicians, we can no longer avoid talking to people about their cancer, and especially at the moment, the isolating time of COVID-19. We do know our patients, and we are in a very privileged position to offer them support. So back to Sue now, and thanks Sue.
Thank you, Juliet, for sharing your experience. Well done. So just a quick recap. For next week is Dr. Gemma Eccles giving us an update around the biology of and the consequences of cancer. So join us next week at 12:15, and thank you for listening to us today. Diolch yn fawr. Thank you very much. Thank you.